2 is false. 4 is true. 6 is true. 8 is false. 10 is true. 2 is true. 4 is false. 6 is true. 8 is false. 10 is false. Key term assessment. 2 is F. 4 is M. 6 is D. 8 is L. 10 is N. 12 is A. 14 is P. 16 is R. 18 is K. Word parts, you should have 2 answers. 2 is cell. 4 is abnormal condition. 6 is clotting. 8, study of. 10, below, deficient. 12, pertaining to. 14, abnormal reduction in number. 16, normal. 18, many. Evaluation of learning. Number 2, to transport nutrients to the tissues to nourish and sustain them, to pick up waste from the tissues, to transport antibodies, enzymes, and hormones. Number 4, the immature form of an erythrocyte contains a nucleus. As the cell develops and matures, it loses its nucleus, causing the cell to acquire the shape of a bioconcave disc, thicker at the rim than at the center. Number 6, 120 days. 8, in the tissues. 10, 150,000 to 400,000 per cubic millimeter of blood. 12, anemia, hyperthyroidism, cirrhosis of the liver, severe hemorrhaging, hemolytic reactions, leukemia, and Hodgkin's disease. Number 14, adult female 37 to 47%, adult male 40 to 54%. 16, acute infections such as appendicitis, chickenpox, diphtheria, infectious mononucleosis, meningitis, and rheumatic fever. 18, neutrophils 40 to 75%, eosinophils 1 to 6%, basophils 0 to 2%, lymphocytes 20 to 40%, monocytes 3 to 10%. Number 20, a lack of iron in the diet known as iron deficiency anemia. 22, iron deficiency anemia and thalassemia. 24, white blood cells are clear and colorless and must be stained to be identified. 26, they have a multi-lobe nucleus that contains 3 to 5 lobes or segments. Or 28, monocyte. 30, hematocrit, HCT, hemoglobin, HGB, differential cell count, DIF, white blood cell count, WBC, red blood cell count, RBC. 32, 10 to 20 seconds. 34, 0.8 to 1.2. 36, heart stroke, thrombophlebitis, recurring atrial fibrillation, heart valve replacement with mechanical valve, in patients exhibiting the signs and symptoms of coagulation disorder. 38, to increase the clotting time to a level that prevents the formation of blood clots without causing excessive bleeding or bruising. 40, light blue stoppered tube. And 42, patient does not have to make periodic visits to a laboratory or medical office to have tests performed. and patient can test without a lab order when conditions occur that may indicate a problem, and treatment can be instituted immediately. All right, so don't forget to send me your results. And are there any questions over chapter 18 or the assignments in the binder? All right, well then let's get started on chapter 19. Everyone turn your book.
I have one question really quick, but it's not about the book.
Okay.
It's just a quick question. Yesterday when Loopy messaged us about having to, or how you said something about being on Evolve 2, how long are we supposed to actually get on there?
Well, so we take in consideration if Evolve is not working properly and keeps kicking you out. But when we pull the report, it'll show when you signed in and when you signed out, right? So like if you sign in and immediately sign out a minute later, I mean, that kind of raises some questions. So we take in consideration, like if you log in multiple times, that's fine. But you know, if you don't sign in at all, or you're only signing in for a minute, then that's where we kind of we start monitoring it.
Okay. Okay, that's it. Thank you.
You're welcome. Okay, Sabrina, so I got this question a lot. What was number 9 on the insurance quiz? Does anyone have that answer? Here, I'm going to repeat number 9 question. How is the person referred to who pays for the health insurance? All right, so let me ask this. If you have insurance and you go to the doctor's office, what do they ask you? Can anybody think?
As far as insurance goes,
Mm-hmm.
what is your policy policy?
That's
Oh yeah.
right. Are you the policy holder, or sometimes are you the primary member? So that would be your answer to number 9. If you put member, I would accept it. If you put policy holder, I would accept that as well. Yeah, that was
Just because
Go
I
ahead.
think it's because the question confused me a little bit, and I was thinking a lot deeper. It's like it was a simple answer, but I was thinking a lot deeper. So I was like searching and searching. I was like, oh my gosh, I cannot find this anywhere.
Yeah. Yeah, it's one of those questions, kind of like, on some of the other assignments, it's not, it's how it's worded. It kind of makes you think a little bit, but in generally, it's pretty much overthought it. Sabrina, don't feel bad. A lot of you guys did, and that's okay. Thought the government or something. Sabrina, you're funny. Well, pretty much. That's kind of what it feels like when they make the deductions out of your paycheck for it. Feels like we're paying the government. All right, so that's a good question. It was very common. I got that a lot yesterday. So not a problem at all. Any other questions? All right, very good. So this afternoon, really quick before we get started, a couple of things. This afternoon, because I don't have many students that jump on for the 1 o'clock, which is fine, right? Most of you guys hop on on the mornings. So I'm going to start because we're kind of ending, right, the online part. We're kind of coming to the last part of it. So I'm still going to hold a lecture at 1, but it's going to be an open floor. So if there's any chapters you've struggled with, any of the homework, any of the assignments, anything like that that you want to do a refresher, go over, it's just an open floor, okay? But like always this morning, once the recording's finished, I'll post it to YouTube, and then that way you guys still have this resource to look back as well. Any questions on that? Okay. Last thing is, did everyone get the email for the clinic schedule? Some of you actually responded, which was great. All right, thank you, Natalie. Thank you, Tina. Now, Tina, I do know for you that your schedule, so we'll have a discussion on that too, but that's fine. All right, thank you, Anna. Thank you, Lily. All right, does anyone have any questions over the schedule? Thank you, Jasmine.
I just think it's crazy that we're like almost done.
Mhm.
Wait, now since today's our last day of class, we pretty much only have like a week and a half left.
Yeah.
That's
Yeah,
crazy.
so we're going to be going over some of the chapters, that we skipped. And I mean, that's pretty much it. So the binder work, other than chapter 13 and yeah, 13, I'm pretty sure it is. And 8, chapter 8 and 13, that really you guys are pretty much done with binder assignments. Oh, okay, Tina, awesome. All right, good. Well, let me know if that changes, okay? Because I know we had a discussion when you signed up about that, so that's fine. Thank you but that's pretty cool. We're pretty much done with the binder, right? We're almost done with all the chapters. Now, if you look, whenever you look on Evolve schedule, you're going to see that I think it's that Wednesday, Thursday, and Friday, or maybe that Tuesday and Wednesday, Thursday. You'll see where it says NHA. So the book covers a lot, but I use the NHA resource to go over some things that need to go in a little further, right? Like our anatomy, terminology, administration, law and ethics, things like that. So we're going to be doing still live lectures, and I'll get more detailed on the schedule for those. But we're going to be using the NHA site off of it. It's pretty cool, and it's not anything any homework on. It's purely just study material. And then hopefully everyone does try to purchase the certification study guide. And that will also help as well. Anna, it's not no nails. I don't mind anyone having nails. They just need to be a working length.
I guess so I got the book a couple weeks ago, and I'm wondering if you have any like resources or ideas for like studying, because I haven't been in school in a long time and I just don't know that right study method to like get things to stick really good. You know what I mean?
Yeah. Well, everybody's different.
I know, that's my thing. Yeah.
For me, flashcards was the best way to do it, right? Like I would write stuff and then like I would scan through the material and I would take down notes of things that I wasn't quite sure. Maybe I really didn't remember going over that. And I would make flashcards out of that. And
Yeah, that's why I bought those little flashcards that I showed you from Etsy, because I'm not very good at like being creative, and I feel like if I just write it down boring, it's not gonna stick in my head. So I got all the like the whole anatomy ones, and then I got like a little pharmacology bundle just to remember like deeper the
good.
medicine, just in case.
Yeah.
So we'll see. I'm gonna try.
Well, I think it's great. I mean, there's a lot of resources out there. I mean, you can order stuff online on Amazon, Etsy. Those are like my 2 top favorite go-to sites anyways. Um, but even if you just do the study guide, right, it's the same thing. I mean, you just kind of, take one thing at a time, read it over. The things that you don't know, make notes. Now, what I will say is once we do get to the clinic and you start doing the hands-on and you get to your extern site, for some of you, um, things are going to really, really click. And then when you match that up with a certification study guide, everything's just going to, I mean, you're like, oh yeah, I know that. Totally. It'll start sinking. But for those of you that are doing the phlebotomy course, which I'm excited for. You won't start externship right when the other MA students will. You'll roll over into the phlebotomy program, and then once that's completed, then you'll start your externship for medical assistant. I'm not certain. Okay, so Alicia asked who else is. Okay, Natalie, thank you. Who else is doing phlebotomy? Alicia, you're the only one that I know for this class. I hope they're. Oh, Sabrina, awesome. Yay, Sabrina's gonna do it. Lily, awesome. I know I have one student in my previous class, Haley. I will be your teacher. So I'll be your instructor for phlebotomy. Yeah.
Would it be covered in the cost with the medical assistant, or will we have to pay for it?
That would be separate. Yeah, but I do think if you do the MA, I think that there is a difference in the cost.
Okay, because I'm paying for this like straight out of pocket,
Okay.
and yeah, I don't know if I'm gonna do phlebotomy.
Yeah, I mean, so that really would be a question for Miss Luby, because I really think that there is a different pay scale if you're doing the MA program as well, but I can't be for certain on that. So that would be a question for her. Now, is it required for you to do the phlebotomy program? No, it's not. You can do a medical assistant and do phlebotomy still, but it does give you a little deeper experience and more practice with the phlebotomy side, and it looks really good on a resume. And it kind of opens up more job opportunities, a little different. Like you can do a lab tech at a hospital. You can work at some of the lab facilities, like LabCorp, Quest. I mean, it just kind of it opens a little bit, a few more doors. Yeah, Sabrina, you just want to have it as a side job too. Yeah, exactly. Exactly. So it just is more doors open up. Now you're still going to have plenty of doors that are going to open up as a medical assistant. It just, it kind of gives you that further step a little bit. But is it a requirement? No. I've done phlebotomy for years as a medical assistant, but back then it wasn't offered, so it's a little different. Yeah. All right, cool. Now, those of you who did not do CPR, I sent an email yesterday. It's been rescheduled for this coming Thursday at 10:30. Remember, you must watch the CPR video that I posted the link to. If you can't hear it, there are subtitles that you can read. All right, Tina, awesome.
Hey, can I have a lecture that day since it's at like 10:30? It's like in the middle.
I'm probably only going to do the one lecture.
1 o'clock.
I'll probably just do the afternoon for that day.
Okay.
Yeah, that way, it kind of gives everybody a little time to do, because there's a lot of you that are going to need to do it. So, yeah. All right, cool. Any questions? Okay. All right, so one last thing, and then we're going to jump right into chapter 19. Sabrina, how will it work? What do you mean, Sabrina? Don't be sorry. Always feel free to ask. But how will what work again?
I think it's all in person, right?
The phlebotomy. Okay, so the phlebotomy class is scheduled to start August the 24th. But it's a little different than the MA class, right? Like you're going to do virtual learning in the morning, and then you're going to see me every day, Monday through Thursday in the afternoon for clinic. And the reason we do that is because phlebotomy is much more of hands-on than anything. And in order to be certified in phlebotomy, you have to have so many sticks, right? I think it's like 40 sticks. So we want to try to get started on that as much as possible. And on top of that, I think it's only like a 5-week course. So it's pretty short, but super packed. So in the morning, it'll be virtual learning. And then in the afternoon, you'll come to the clinic every day. Yes, ma'am.
I know, I'm kind of too.
Oh, that's the funnest part, right? Um, Tina, I think so. That would be a good question for Miss Loopy because I think I think we could work something out for that. Lily, it does start around the same time. So if you do the MA program and then you want to do the phlebotomy, you'll be considered in a rollover, right? So for our MA externs, tentatively, you will start your externship on the 24th, right? The same day the phlebotomy class starts. So instead of going to your externship, you would then start the phlebotomy class. Once you're done with the phlebotomy class, then you will start we'll place you in your extern site for your medical assistant side. You're welcome, Tina. But I mean, yeah, so in generally, right, the externship part on the phlebotomy, before COVID, right, we actually opened up the clinic to where guests, a lot of Ferris City folks or your friends and family, they can come and you'll get your sticks off of them. Because of COVID, we can't do that. So your resource for your sticks is going to be your students. It's going to be the staff, which includes me, which I don't mind you guys sticking me anyways. But you'll have Miss Sydney, Miss Michelle, Miss Loopy, possibly even Miss Joe, our dental instructor. So it's pretty cool. So we're going to have those resources, but all the more reason why you want to try to get as many successful sticks as possible. That's the key. Oh, it's not going to be an ouch, I promise. Well, so the upside of being scared of needles, Lily, is that in generally you're not going to be the one that's getting stuck after the classes. It'll be others. But, I think that's pretty common.
Wait, we have to stick each other?
Mm-hmm.
No.
Yes, ma'am. Yes, ma'am. What if I stick someone wrong or vice versa? Well, so that's what I'm here for, right? I'm going to make sure that you know the right way and train you on the right way. So that's the only way you know. And you can, kind of change your technique to what you want, but that you're not, for the first little bit, you're not going to be just, I'm going to hand you, you're just going to go get your supplies and stick your partner and I'm not going to watch. Nope. I'm going to be right there with every single one of you. All right. Awesome. All right, well, let's get started on chapter 19, blood chemistry and immunology. So this one's a little bit bigger than chapter 18, not by much. All right, introduction to blood chemistry and immunology. Clinical Laboratory Improvement Amendments, CLIA, waived blood chemistry and immunologic laboratory tests are often performed in the medical office. Advances in the CLIA waived automated blood analyzers and testing kits designed specifically for use in the medical office have made this possible. Automated blood analyzers perform laboratory tests in a short time with accurate test results. This chapter is divided in two units. The first presents blood chemistry laboratory test, and the second presents immunologic test. The material in this chapter about blood testing is intended to serve only as a basic guide for the medical assistant and should be supplemented by much well-supervised practice in the classroom, laboratory, the medical office, or both. All right, Alicia, go ahead and read blood chemistry.
Blood chemistry involves the quantitative measurement of chemical substances in the blood. These chemicals are dissolved in the liquid portion plasma of the blood. Numerous types of blood chemistry tests are available. The type of test or test the provider orders depends on the clinical diagnosis. Table 19.1 lists common blood chemistry tests with specimen requirements, normal values, and conditions that cause abnormal test results. The blood chemistry tests that are most frequently performed are described in greater detail in this chapter.
All right, very good. So on blood chemistry, you're going to highlight the first two sentences. And let's see. Anna, can you go ahead and read collection of blood chemistry specimen?
Most blood chemistry tests performed at an outside laboratory requires a serum specimen for analysis, figure 19.1. If the specimen is collected at the medical office, the medical assistant will need to perform a venipuncture using a serum spectra tube, SST, or a red stopper tube. An example of a blood chemistry profile frequently ordered on patients in the medical office is a comprehensive metabolic profile, MCP. A MCP contains numerous blood chemistry tests and is used primarily in routine health screenings for a patient. It is frequently used to detect any changes in the body's biological processes that may be present, although the patient may not have had any symptoms to indicate that these changes have occurred. A comprehensive microbiologic profile is also used when the patient's symptoms are so vague that the provider does not have enough concrete evidence to support a clinical diagnosis for a specific organ.
686 as well.
Yeah, organ or disease state specimen collections and handling requirements for a comprehensive metabolic profile as presented in the laboratory dictionary or laboratory website are outlined in figure 19.2.
Okay. So on page 683, you're going to highlight the first sentence, and where it says using a serum separator tube or SST or a red stopper tube, and then highlight the words comprehensive metabolic profile, CMP. And then I want everyone to turn to page 684. Okay, so these are going to be our common blood chemistry tests. A couple chapters, someone had a question about, what are some common tests and, what is it used for? This is where it kind of goes over that just a little bit. So if you notice the first one, our alanine aminotransferase, ALT, it says the purpose is to detect liver disease. And then it kind of gives you a reference range. And then, let's see here, I'm trying to think of another one. Cholesterol is pretty common. Fasting blood glucose. Potassium, that's a common one. Triglycerides, uric acid. All right, any questions on that? Okay, so let's go on over to page 686 and automated blood chemistry analyzers. Let's see, Jasmine, can you read the first and second paragraph?
Automated blood chemistry analyzers are used to perform blood chemistry testing. A blood chemistry analyzer consists of a reflectance photometer that quantitatively measures the amount of chemical substances or analytes in the blood. An analyte is defined as a substance that is being identified or measured in a laboratory test. Specifically, a reflectance photometer measures light intensity to determine the exact amount of an analyte in a specimen. Most providers consider it too expensive in terms of equipment, supplies, and medical laboratory personnel to perform blood chemistry tests in a medical office that are any more complex than wave tests. These tests are usually performed at an outside laboratory. However, if moderately complex blood chemistry tests are performed in the medical office, a benchtop blood chemistry analyzer is typically used to run them. Examples of these non-wave benchtop analyzers include the ATAC lab system, figure 19.3, and the Reflectron analyzer, Examples of CLIA-waived blood chemistry analyzers that are more commonly used to run blood chemistry tests in the medical office include the Accu-Chek Advantage Blood Glucose Meter, Roche Diagnostics, A1C. How do I start this?
That's fine.
Oh.
Okay.
Yeah.
So in the first paragraph, I want you ladies to go and highlight the first sentence. And then highlight where it says an analyte is defined as a substance that is being identified or measured in a laboratory test. All right. Lily, can you please go ahead and read the next two paragraphs?
The manufacturer of each blood chemistry analyzer provides an operating manual and sometimes an instructional video with the instrument that includes information needed to collect and handle the specimen, perform quality control procedures, and test the specimen. The manufacturer also has personnel available for on-site training and service. Because most medical offices use CLIA-waived blood chemistry analyzers rather than non-waived analyzers, the remainder of this chapter focuses on CLIA-waived blood chemistry analyzers used in the medical office. It is important that the medical assistant becomes completely familiar with all aspects of the CLIA-waived analyzer used to perform blood chemistry testing in his or her medical office. Medical office running CLIA-waived tests are required to follow the manufacturer's instructions exactly for each testing procedure. Instructions include information on the quality control procedures that must be performed when running tests. Quality control procedures are of particular importance to ensure that the analyzer is functioning properly and that the test results are reliable and accurate. Additional information on quality control procedures is presented next.
All right. Let's see here. Natalie, can you please read quality control?
The ultimate goal when performing blood chemistry testing is to ensure that the test is accurately measures what it is supposed to measure. This involves practicing and maintaining a quality control program, which quality control consists of methods and means to ensure that test results are reliable and valid. Two important quality control measures must be performed routinely when a blood chemistry analyzer is used: calibration of the instrument and running controls.
All right, very good. All right, you're going to highlight where it says quality control consists of methods and means to ensure that test results are reliable and valid. All right, Sabrina, can you read calibration?
Calibration is a mechanism used to check the precision and accuracy of a blood chemistry analyzer to determine if the system is providing accurate results. A calibration check detects errors caused by laboratory equipment that is not working properly. Calibration is typically performed using a calibration device, often called a standard. The calibration device may come in form of calibration strip or cassette. The device is inserted into the analyzer and the calibration results are displayed on the LCD screen of the analyzer. The calibration results are then compared with the expected results provided in the product insert or on the calibration device. If the calibration procedure does not perform as expected, patient testing should not be conducted until the problem has been identified and resolved. The frequency of performing calibration check is indicated in the manufacturer's instructions. At minimum, the calibration check should be performed when a new lot number of testing regions is put into use.
All right, very good. So we touched base on this right in the last chapter. What's something else? What was something else that was recommended that you need to do a calibration check when you are working with a new lot number? Does anybody remember? So when we order a new box of, when we open a new lot number for pregnancy tests, we have to do the same thing, right? We have to check the controls when it's a new lot number. All right, so for calibration, I want you to highlight that calibration is typically performed using a calibration device, often called a standard. The calibration device may come in the form of a calibration strip or cassette. All right, Talia, can you please read controls? Read the, yeah, are you where you can read all of controls?
A blood chemistry control consists of a solution that is used to monitor a blood chemistry analyzer to ensure the reliability and accuracy of the test result. Control consists of a commercially available solution with known values. Controls usually come with a product insert which lists the expected ranges from control results. However, expected ranges may sometimes be printed on the containers of the testing regions. Controls are used to determine if the testing regions are performing properly and to detect any errors in techniques by the individual performing the test. Generally, 2 levels of control must be performed on a blood chemistry analyzer. A low-level control, also known as a level 1 control, produces results that falls below the reference range of the test. A high-level control, also known as a level 2 control, produces results that fall above the reference range for the test. The control procedure is performed in a similar manner to the procedure for performing the test on a specimen collected for a patient. Instead of the patient specimen being added to the test device, with expected results provided in the product insert, see figure 19.5, or on the container testing region 19.7. Failure of a
Sorry, go ahead. You're good.
Failure of a control to produce expected results may be due to the following: deorientation, to expired testing components, or implementing testing conditions, or errors in the technique used to perform the procedure. If the controls do not perform as expected, patient testing should not be conducted until the problem has been identified and resolved. The frequency or performing controls is indicated in the manufacturer instructions. At a minimum, they should be performed on each new lot number of testing regions and therefore on a regular daily basis, such as monthly.
All right. So in the second paragraph, I want you to highlight that a low-level control, also known as level 1 control, produces results that fall below the reference range for the test. A high-level control, also known as level 2 control, produces results that fall above the reference range for the test. And in the next paragraph, I want you to highlight failure of a control to produce expected results may be due to the following: deterioration of testing components due to expired testing components or improper storage, improper environmental testing condition, or errors in the technique used to perform the procedure. If the controls do not perform as expected, patient testing should not be conducted until the problem has been identified and resolved. All right. Tina, can you please read blood glucose on page 590?
Glucose is a product of carbohydrate metabolism. It is the chief source of energy for the body. Energy is needed to perform normal functions and to maintain body temperature. Body maintains a constant blood glucose level to ensure a continuous source of energy for the body. Ingested glucose that is not needed for energy can be stored for later use in the form of glycogen in muscle and liver tissue. When no more tissue storage is possible, excess glycogen is converted with triglycerides, a form of fat, and is stored as adipose tissue. Insulin is a hormone secreted by the beta cells of the pancreas that is required for the normal use of glucose in the body. Insulin enables glucose to enter the body's cells and be converted to energy. Insulin is needed for the proper storage of glycogen in liver and muscle cells.
All right. So you're going to highlight the first sentence and then highlight where it says ingested glucose that is not needed for energy can be stored for later use in the form of glycogen in the muscle and liver tissue. And then highlight the first sentence in the next paragraph. All right, Alicia, can you please read blood glucose testing?
Measuring the amount of glucose in a blood specimen is one of the most commonly performed blood chemistry tests. It is used to detect abnormalities in carbohydrate metabolism, such as those that occur in prediabetes, diabetes, gestational diabetes, hypoglycemia, and liver and adrenocortical dysfunction. Blood glucose is measured by several different testing methods, which include the fasting blood glucose, the 2-hour postprandial blood sugar test, and the oral glucose tolerance test. Each of these methods serves a role in diagnosing and evaluating abnormalities in carbohydrate metabolism, and each is described in greater detail here.
Okay. So I want you to highlight where it says blood glucose is measured by several different testing methods, which include the fasting blood glucose, the 2-hour postprandial blood sugar test, and the oral glucose test. All right. Anna, can you please read fasting blood glucose?
Blood glucose is usually measured when the patient is in a fasting state. This type of test, terms a fasting blood glucose (FBG), involves collecting a fasting blood sample and measuring the amount of glucose in it. The patient should not have anything to eat or drink except for water for 12 hours preceding the test. Concerning certain medications such as oral contraception, salicylates, diuretics, and steroids may affect the test results. The provider may place the patient on medication restrictions for a specific period before the test, usually 3 days. The patient should be scheduled for the test in the morning to minimize the inconvenience of abstinence from food and fluid. An FBG is often performed on patients diagnosed with diabetes to evaluate their progress and regulate treatment, and on other patients as a routine screening test to detect prediabetes or diabetes. Prediabetes is the term used to describe the condition in which glucose levels are higher than normal, but not enough to be classified as diabetes, and individuals with prediabetes has a increased risk of developing type 2 diabetes. The American Diabetes Association ADA recommends the following test guidelines for interruptions for FBG test results.
All right. So on the fasting blood glucose, in the first paragraph, I want you to highlight where it says termed a fasting blood glucose FBG involves collecting a fasting blood sample and measuring the amount of glucose in it. Highlight the patient should not have anything to eat or drink except water for 12 hours preceding the test. Excuse me, in the next paragraph, highlight where it says pre-diabetes is the term used to describe the condition in which glucose levels are higher than normal, but not high enough to be classified as diabetes. And then highlight that the American Disease Association, the ADA, recommends the following guidelines for interpretation of the FBG test results. And then you're going to highlight the test results and the interpretation for normal, pre-diabetes, and diabetes. All right, any questions so far? Jasmine, can you read 2-hour postprandial blood glucose test?
The 2-hour postprandial blood glucose test, 2-hour ppbg test, is used to screen for diabetes and to monitor the effects of insulin dosage in patients with diabetes. The patient is required to fast beginning at midnight preceding the test and continuing until breakfast. For breakfast, the patient must consume a prescribed meal that contains 100 grams of carbohydrate, which consists of orange juice, cereal with sugar, toast, and milk. An alternative to this is a consumption of a 100-gram test load glucose solution. A blood specimen is collected from the patient exactly 2 hours after consumption of the meal or glucose solution. In a non-diabetic patient, the glucose level returns to the fasting level within 1.5 to 2 hours of glucose consumption, whereas the glucose level in a diabetic patient does not return to the fasting level. A postprandial glucose level of 140 grams, deciliter? I don't know, or higher suggests diabetes and warrants further testing, such as the oral glucose tolerance test.
All right, very good. Thank you. So in the first paragraph, you're going to highlight that a 2-hour postprandial blood glucose is 2-hour ppbg. And then highlight where it says consume a prescribed meal that contains 100 grams of carbohydrate, which consists of orange juice, cereal with sugar, toast, and milk. Ugh, that's too much sugar. And then highlight an alternative to this is the consumption of a 100-gram test load glucose solution, and a blood specimen is collected from the patient exactly 2 hours of consumption of that meal or glucose solution. All right, Lily, can you read oral glucose tolerance test?
The oral glucose tolerance test provides more detailed information about the ability of the body to metabolize glucose by assessing the insulin response to a glucose load. The OGTT is used to assist in the diagnosis of prediabetes, diabetes, gestational diabetes, hypoglycemia, and liver and adrenocortical dysfunction. It provides a more thorough analysis of glucose than is provided by the FBG and 2-hour ppbg.
Yeah, it's kind of like a television, right? CBC, FBG. All right, very good. So you're going to highlight the first 2 sentences. All right, Natalie, can you read testing requirements?
The patient is usually required to consume a high carbohydrate diet consisting of 150 grams of carbohydrate per day for 3 days before the oral glucose tolerance test. The patient must be in a fasting state when the test begins. On the morning of the test, a blood specimen is drawn from the patient from an FBG. If the FBG indicates hyperglycemia, the provider should be notified because this situation is a contraindication for the administration of a large test load of glucose. After the FBG has been performed, the patient is instructed to drink a solution containing 75 grams of glucose within a 5-minute time frame. At regular intervals thereafter, a blood specimen is taken to determine the patient's ability to handle the increased amount of glucose. Each blood specimen must be labeled carefully with the exact time of collection. The patient is permitted to eat and drink normally after completion of the test. It is important that the patient adhere to certain restrictions during the test to ensure accurate results. Because food and fluid affect blood glucose levels, the patient must not eat or drink anything except water during the test. Smoking is not permitted during the test because tobacco is a stimulant that increases the blood glucose level. The patient should remain at the testing site so that he or she is present when needed for collection of blood specimens and to minimize activity. Activity affects the test results by using up glucose. The patient should remain relatively inactive during the test. Sitting and reading is an activity that would be recommended.
Very good. Okay, in the first paragraph, I want you guys to highlight where it says consisting of 150 grams of carbohydrate per day for 3 days before the oral glucose tolerance test. Highlight on the morning of the test, a blood specimen is drawn from the patient for an FBG. In the next paragraph, you're going to highlight the first sentence. And in the last paragraph, highlight, because food and fluid affect blood glucose levels, the patient must not eat or drink anything except water during the test. Smoking is not permitted during the test because tobacco is a stimulant that increases the blood glucose level. And then highlight the words minimize activity. All right, Sabrina, go ahead and read side effects for me, and then we're going to do our case study number 1.
During the test, the patient may experience some normal side effects, including weakness, a feeling of faintness, and perspiration. These are considered normal reactions of the body to a decrease in the glucose level as insulin is secreted in response to the glucose load. The patient should be reassured that this is a temporary condition. Serious symptoms of severe hypoglycemia should be reported immediately to the provider. These may include a headache, pale cold, and clammy skin, irrational speech or behavior, profuse perspiration, and fainting.
Very good. All right, so on the side effects, you're going to highlight the first sentence. Highlight the word serious symptoms, and that these may include headache, pale, cold, and clammy skin, irrational speech or behavior, profuse perspiration, and fainting. All right, case study number 1. Crystal Llewellyn is at the medical office for an oral glucose tolerance test. She says that she tried not to eat anything, but she started shaking. So she stopped at McDonald's on the way over and got a sausage biscuit and orange juice, which sounds really good right now. Crystal gets quite upset when she learns that she has to come back again to have her test run. She said that she hired a babysitter to watch her 4 preschool-aged children. She demands to know why this test takes so long and why she can't have anything to eat before the test. Crystal wants to know if she can bring her children next time so she doesn't have to hire a babysitter. Crystal says that she's a nicotine addict, and when she's not needed for testing, she could take the kids outside to play. She says that the kids won't bother anymore, and she can have a cigarette at the same time. Oh, goodness. All right. My medical assistants, what would you do?
Explain to her I understand that she's frustrated because she probably wants to eat a cow, but it'll interact with the testing, and also she shouldn't smoke because, like I just said, it increases the blood glucose level.
That's right.
So she shouldn't eat or smoke. So yeah.
Yeah. All right. Good. What else? Anything else?
I guess you could explain to her why the test takes so long, or because she said, why does it take so long and why can't she eat anything before? I guess just get a little deeper and explain that to her so she understands fully why.
Right. Yeah, because a lot of people don't think that some of these testing takes that long, right? Like they don't understand. But if we explain the process and the purpose of the testing and why that the patients have to have detailed instructions, preparation, then sometimes that helps calm them down. All right, good. Anything else?
I mean, I know some doctor's offices have like a little kid area where they can play. So can she bring her kid? I think it just depends on the place, right?
Yeah.
Yeah.
So if the testing is being held at a doctor's office, it's probably not a big deal. But you have to remember, because like we just read that activity, right, can affect the glucose levels. So the fact that she has not one but 4 kids, that's going to be really hard for her to kind of sit and relax, whether they're playing or not. So, unfortunately, I mean, it really, she could bring her kids, but she needs to have someone else with her that can look over the kids so she can follow the instructions for the test. Because otherwise, again, we're not going to get accurate results, and that could lead to another repeat testing. All right, good. What else? Anything else? All right, what do we not want to do?
You don't want to judge her for the fact that she ate or that she has nicotine addiction.
Yeah. Yes. Very good. Now, by reading this case study, what do we think the tone of this patient is? Right? Does she seem super sad? Does she seem calm?
Angry or frustrated?
Yeah. Angry and frustrated. So what's the one thing that we don't want to come across as?
Rude.
Yeah, rude and defensive, right? Like,
Yeah.
well, I'm sorry, you shouldn't have eaten. Yeah, we don't want to do that because that's just going to cause the situation to explode. So it is hard. What was that?
Yes, and you will learn that a lot of your will be like this, and you have to deal with them every day in person and on the phone. So the calmer you stay and the more professional you stay, the easier it is to keep them calm and from making a scene in your office.
Exactly. And it all comes down to the way you react, right? Like just in life situations. As a medical assistant, these patients are coming in, they're scared, they're frustrated, they're confused. They don't know what we know, right? They're just doing what they're told, but they have questions. And then if they overthink or they're thinking too much, it just, it causes some chaos. And if they have stuff going on at home, right? If I have 4 kids, I'm probably going to be pretty irritated too. But we have to make sure that we remain calm, right? We have to be understanding and patient. And generally, if you're able to contribute that back to your patient, they're more than likely going to start calming down. We understand. I understand you're frustrated. But, it's this type of test, it's really important that we get accurate results. We don't, you don't want to take medication if it's not needed. You don't want to follow specific diet instructions if it's not needed, right? Like you just kind of have to get down on their level and talk to them. But you're going to come across this. Patients are bringing what's going on at home. They're bringing it right to you, and they're just going to lay it all on you. And you got to remember don't feed into that. You stay calm, professional, level-headed, and usually everything will work out fine. All right. Any questions on that? All right, very good. Let's see, Talia, can you read interpretation of results?
A glucose is observed in the bloodstream. The glucose level of non-diabetic individual increased to a peak level of 160 to 180 milligrams, approximately 30 to 60 minutes after the glucose solution is consumed. The pancreas creates secretes insulin. The pancreas secretes insulin to decompensate for this rise in the blood glucose returns to the fasting level within 2 hours of ingestion of the glucose solution. The individuals with diabetes do not exhibit the normal use of glucose just described. This is because individuals with diabetes are unable to remove glucose from the bloodstream at the same rate as non-diabetic individuals. The blood glucose peaks at a much higher level. In addition, blood glucose levels are above normal throughout the test because of the lack of insulin. 2 hours of the glucose solution is consumed. The test results are interpreted according to the following guidelines set forth by the American Diabetes Association, ADA.
Good. Tina, can you go ahead and read hypoglycemia?
Hypoglycemia is a condition in which the glucose in the blood is abnormally low, FBG below 70 milligrams. During the OGTT, patients with this condition exhibit an abnormally low blood glucose level, beginning at the 2-hour interval and continuing for 4 to 5 hours. Hypoglycemia results from removal of glucose from the blood at an excessive rate or from decreased secretion of glucose into the blood, which can be caused by an overdose of insulin. Addison's disease, bacterial sepsis, carcinoma of the pancreas, hepatic necrosis, and hypothyroidism.
Very good. All right, so for hypoglycemia, you're just going to highlight the first sentence. Alicia, can you read test for management of diabetes?
It is important for individuals with diabetes to manage their condition effectively. This is best accomplished by keeping blood glucose levels as close to normal as possible. Diabetic patients who maintain good blood glucose control generally experience fewer symptoms and delay or prevent long-term complications of the disease. These results can lead to a longer life. 2 testing methods are used for the management of diabetes: self-monitoring of blood glucose and the hemoglobin A1C test. Self-monitoring of blood glucose, which diabetic patients perform at home, measures day-to-day fluctuations in the blood glucose levels. The hemoglobin A1C test must be ordered by the provider and provides an average or overall picture of the patient's blood glucose level over time. These testing methods assist the patient and the provider in determining whether the diabetes management plan is working or whether it needs to be adjusted.
All right, very good. So you just need to highlight the first sentence on page 691 for test for management of diabetes. All right, self-monitoring of blood glucose. Anna, can you go ahead and please read that?
Individuals with diabetes cannot usually tell by the way they feel whether or not their blood glucose levels are within range. The only way for them to know for certain is by self-monitoring of blood glucose, SMBG. SMBG not only provides diabetic patients with feedback of maintaining normal blood glucose levels, but it's also assists them in anticipating and treating by day-to-day or even hour-to-hour fluctuations in glucose levels brought on by food, exercise, stress, and infections. Diabetic patients who take insulin dependence must monitor their glucose levels each day based on the results of SMBG. Decisions can be made regarding insulin and dietary adjustments that may be necessary to maintain normal glucose levels and to avoid the extremes of hyperglycemia and hyperglycemia. See chapter 21 is satisfactory controls of the blood glucose levels on a day-to-day basis through SMBG reduces symptoms of the diabetic through the disease. It helps delay and prevent long-term complications that can occur with diabetes.
All right, very good. Okay, so you're going to highlight where it says the only way for them to know for certain is by self-monitoring of blood, SMBG. SMBG not only provides diabetic patients with feedback for maintaining normal blood glucose level, but it also assists them in anticipating and treating day-to-day or even hour-to-hour fluctuations in glucose levels brought on by food, exercise, stress, and infection. In the next paragraph, highlight, based on the results of the SMBG, decisions can be made regarding insulin and dietary adjustments that may be necessary to maintain normal glucose levels. All right, and then we're going to turn to page 694. All right, case study number 2. Dave Felden has recently been diagnosed with type 1 diabetes and is taking insulin. He has come to the office for an FBG. A finger stick will be performed to collect the specimen, and a glucose meter will be used to test the specimen. Dave has been performing this test on himself at home for 2 weeks and wants to know whether he can stick his own finger. Dave says that he's been having a few problems giving himself his insulin injection. He says that he has been getting some very large air bubbles in the syringe when he draws up the insulin. He says he's been having trouble getting them out and wants to know how important that is. Dave said that he's on a limited income and wants to know whether he could use his needle and syringe for more than just one injection. So sadly, this is pretty common. All right, so let's start with the first part. What would you do?
Use his needles more than once and show him how to properly drop his insulin.
Yep.
How to solve the problems with the bubble.
Good. Yep. Yep, and that's a pet peeve of mine. I do not like seeing bubbles in a syringe. So let me ask, what is the importance, and we've covered this before, what is the importance of not having bubbles in your syringes? Like, why is that so important?
Like, if it gets in your vein or something, can't that kill you?
Well, not so much it gets into your vein, because generally you shouldn't be doing injections in the vein.
I know that. Okay, not in the vein, but like
If you
Say it one more time, Tina.
should be not air, using the correct amount of
That's
your
right.
medication.
That's right. So if you have even one big bubble, right, that's taking space where medication should be, which means you're probably not injecting the correct amount of that either you or the patient should be getting. And in this case, it could be that probably would explain why he probably has some alterations in his results, right? He's not even given the correct amount of medication that he should. So yeah, so that's a big thing of why we don't want bubbles in our syringes when we do injections, and even for the patient. Now, he asked if he could stick himself. What do y'all think? Do you think he can or he shouldn't?
I don't think you should, just to make sure that everything's sterile. I mean, can he?
Yeah. So he actually can.
So what's the point of him coming?
Well, so the one case is when a patient has diabetes, right? Even type 1, they have to be able to monitor their sugars at home, right? They have to, you know, it would be more expensive for a patient to come every day and have an MA give him his medication, stick his needle to run the sugar testing. That's why you can get stuff over the counter. Like I can go to Walmart and I can buy a glucose testing monitor. I can buy the testing strips. So that's the one time where the patient can. Now, can he stick himself? He can. He can. And you can actually make that into a teaching moment, right? Like, you know, make sure, be like, yeah, I'll let you go and stick yourself, and I'll just make sure that you don't have any questions. Yeah, I mean, he can because he's doing it at home. I mean, he's having to give his own insulin injection. So, yeah, in this case, now, if we're just doing a routine testing for a physical examination, no. But for our diabetes patients, yeah, it's okay. All right, good. Anything else? What do we not want to do?
Sometimes other people can make other people feel like they're dumb for asking certain questions.
Yeah,
So make him feel as comfortable as possible.
that's right. Yeah, very good. Yeah, it's all about teaching moment. I mean, that would be like y'all's first day of class, and I'm laughing because y'all don't know how to take a blood pressure. How would you know, right? And that's the same thing that we have to look at for our patients. You don't know unless you're taught. Most of these patients do not know. They don't. That's where we come in. All right, very good, ladies. Okay, Jasmine, go ahead and read frequency of testing on page 694.
The frequency of blood glucose testing depends on numerous factors, including the severity of the diabetes, diet, activity level, and special conditions such as pregnancy. Ideally, the blood glucose level for an insulin-dependent diabetic patient should be measured 4 times a day: in the morning after an 8-hour fast, before lunch, before dinner, and at bedtime. The FBG test result obtained in the morning is the best overall indicator of control, and the other determinations provide guidance for adjusting insulin dosage, diet, and exercise.
All right. So you're going to highlight where it says the blood glucose level for an insulin-dependent diabetic patient should be measured 4 times a day: in the morning after an 8-hour fast, so after they sleep, before lunch, before dinner, and at bedtime. Now, again, why are they doing it before their meals and not after?
Because the meals will cause inaccurate test results.
Yeah. Eating can change their levels by what they eat. So they need to make sure that before they eat, they're not, that they're getting more of an accurate. And then the fact that they're going to do it at bedtime, that's going to monitor with what they have eaten, right? All right. Very good. Let's see. Lily, go ahead and read test results.
Blood glucose levels are measured using a glucose meter, and the results are displayed in milligram per, is it deciliter? The mg/dl.
Oh, the mg/dl. Yeah, milligrams per. Hold on. I don't deal a lot with the deal.
I think it's deciliters. I'm not sure.
What are we reading? What's happening?
Yeah, it's deciliter.
Deciliters, yeah.
Milligrams per deciliter?
Yep.
Table 19.2 lists recommended blood glucose levels for patients with diabetes based on when the testing is performed. Diabetic patients should be instructed to maintain a cumulative record on their daily SMBG test results for periodic review by the provider. This record assists the provider in making decisions regarding the patient's diabetes management.
All right, very good. So let's take a look at table 19.2. So recommended blood glucose levels for patient with diabetes. So before meals, it should read 80 to 120, 1 to 2 hours after meals, 100 to 180, and at bedtime, 100 to 140. Advantages. Research shows that SMBG is the most effective way for a diabetic patient to maintain a normal blood glucose level and delay or prevent long-term complications associated with diabetes. High blood glucose levels greater than 180 for a long time can cause progressive damage to the body organs, resulting in blindness, kidney disease, nerve damage, and circulation problems. Highlight that sentence. Because of the necessity of performing a skin puncture and the fact that the patient must assume responsibility in self-management decisions, the medical assistant may need to reinforce the advantages of self-monitoring of blood glucose as follows. Number one, the convenience of testing. The patient is able to test his or her blood at any time of any day without a laboratory order from the provider. This provides a distinct advantage because patients are able to check their blood glucose level when a side effect common to diabetes occurs, such as hypoglycemia. In these situations, treatment can be instituted immediately to prevent the problem from getting worse. Number two, greater involvement in self-management decisions. The patient is able to become more involved in self-management decisions regarding insulin dosage, meal planning, and physical activity. Initially, some patients lack confidence in making insulin and dietary adjustments based on the blood glucose test results. The medical assistant should provide encouragement and stress the benefits to be delivered in terms of improvement regulation of the blood glucose level. Number three, reliable decision making regarding insulin dosage. More reliable decisions regarding insulin needs to be made during situations that affect the blood glucose level, such as an illness, emotional stress, increased physical activity, or suspected hypoglycemia. Number four, delay in or prevention of long-term complication. The medical assistant should emphasize to patients how important it is to perform daily SMBG testing to increase their chances of staying healthy. As previously discussed, diabetic patients who maintain good blood glucose control generally experience fewer symptoms and a delay in or prevention of long-term complications of the disease. All right, hemoglobin A1C test. Natalie, go ahead and read the first paragraph, please.
A hemoglobin A1C test, HbA1c test, or A1C test, provides valuable information for determining whether a diabetic patient's blood glucose level is under control. The A1C test supplies the provider with an assessment of the average amount of glucose in the blood over a 3-month period. When an individual consumes food containing glucose, the glucose is absorbed by the digestive tract and into the circulatory system. Glucose sugar has a sticky quality to it and thus has a tendency to stick to protein in the body. One of the proteins it attaches to is the protein included in hemoglobin. Hemoglobin is found in red blood cells and functions in transporting oxygen in the body. The process of glucose attaching to hemoglobin is known as glycosylation. When glucose attaches or glycosylates to the protein in hemoglobin, it forms a compound known as hemoglobin A1C. Glycosylation occurs in all individuals. Hemoglobin A1C is formed in diabetic patients and healthy individuals. The amount of glucose that attaches to hemoglobin is proportional to the amount of glucose in the blood. The more glucose in the blood, the more hemoglobin becomes glycosylated and the higher the A1C level. Individuals with undiagnosed or poorly controlled diabetes have a higher than normal blood glucose level and more hemoglobin A1C forms in these individuals. The percentage of hemoglobin A1C in the blood can be measured by the A1C laboratory test. The attachment of the glucose to the hemoglobin is permanent for the life of the red blood cell, 90 to 120 days. The A1C test result is able to provide an overall picture of the patient's blood glucose level for the past 3 months. CLIA waived analyzers are available for performing a hemoglobin A1C test in the medical office. An example is the A1C Now Bayer Corporation.
All right, very good. Y'all make sure to tell Nancy that she's not the only one that gets stuck reading some doozy words. Okay, so on the hemoglobin A1C, you're going to highlight the last sentence in the first paragraph. So your doctor is going to order this frequently. This is a very, very common test that your doctor's going to order. So hemoglobin A1C. All right, interpretation of results. Sabrina, can you go ahead and read interpretation of results, please?
The normal A1C level for an individual without diabetes is 4% to 6%. Patients with diabetes usually have a higher A1C level than this. The American Diabetes Association strongly recommends that the patients with diabetes maintain an A1C level of less than 7%. Table 19.3 shows the correlation between hemoglobin A1C percentages and average blood glucose levels. A change in a patient's diabetes management plan is almost always required if the A1C test results is greater than 8%. Patients who keep their hemoglobin A1C levels close to 7% have a much better chance of delaying or preventing diabetic complications than do patients with A1C levels that are 8% or higher. Studies show that for every 1% percentage point drop in the A1C value, a 35% reduction in risk for diabetes-related complication occurs. The provider orders an A1C test when a patient is first diagnosed with diabetes to determine how elevated the blood glucose level has been before the condition was diagnosed. The test is usually ordered several times after diabetes management plan has been prescribed to verify that the blood glucose control is being achieved. The A1C test is ordered periodically for patients already diagnosed with diabetes to evaluate the effectiveness of their diabetes management plan. For stable diabetic patients under good control, the test is typically ordered at least 2 times a year, every 6 months. The test is usually ordered on a more frequent basis for patients who have a difficulty maintaining control of their blood glucose levels. The A1C test also is ordered when the provider makes an adjustment to a patient's diabetic management plan to assess the effectiveness of the change in treatment.
All right, very good. Thank you. Okay, so you're going to highlight the first sentence and the third sentence. So the A1C, like I said, it's a very common test that's ordered. Your doctor is going to probably make it a routine order for your, if your patients are just coming in for their yearly physical exam, and they probably will check your patient's lab work at least every 6 months if they have a family history of diabetes, just to monitor it. So this is a really, really common blood test. All right, any questions about anything so far, ladies? Okay. Talia, can you please read glucose meters?
In the medical office, a CLIA wave glucometer is often used to measure the blood glucose level quantitatively. The test most frequently performed using the glucose meter and the FBG, although some offices also perform the OGTT and the 2-hour postprandial test. By measuring blood glucose concentration in the medical office, better patient care can be provided. On-site tests eliminates the time requirement for an outside laboratory to provide the results, allowing the provider to make decisions immediately regarding diagnosis, treatment, and follow-up care. Procedure 19.1 describes how to measure blood glucose using the ACCU Check Advantage glucose meter.
All right, very good. All right, Radiant test strips. Tina, can you go ahead and read that, please?
A rapid test strip must be used with the glucose It consists of a plastic strip with a reaction pad. The pad contains chemicals that react with the glucose in the whole blood to determine the glucose level in milligrams. Through an electronic signal, glucose results are displayed as a digital readout. The manufacturer's instructions accompanying the glucose meter must be followed exactly to ensure accurate and reliable test results. It is important to store the container of test strips properly to prevent their deterioration, which affects the test results. The chemical the reagents on the strips are sensitive to heat, light, moisture, and might be stored in a cool, dry area at room temperature, less than 90 degrees Fahrenheit, with the cap tightly closed. Strips that are discolored or that have darkened should be discarded to prevent inaccurate test results. The container of test strips includes a desiccant. Its purpose is to promote dryness and absorbing moisture.
Very good. Okay, so in the second paragraph, you're going to highlight where it says the chemical reagents on the strips are sensitive to heat, light, and moisture and must be stored in a cool, dry area at room temperature with cap tightly closed. And then highlight the last sentence. The container of test strips includes a desiccant. Its purpose is to promote dryness by absorbing moisture. Actually, that would be the last two sentences. I'm sorry. All right, so funny story, when we were driving on our way to Tennessee last week, my husband got a big bag of beef jerky from the gas station. And, you know, it has those little desiccant packs in it, right? And he was just eating away, and he grabbed it. He almost ate it because he wasn't paying attention to what he was doing. So don't do that. That'd be bad. Now, when we get to the clinic, you're going to see that I'm going to stay on top of you guys, because this is the one thing that we're going to be doing quite a bit, is to make sure that we are properly storing and closing the lids on our glucose meters. All right, any questions? All right. Alexis, are you where you can read calibration procedure? Alicia, can you read calibration procedure?
A calibration procedure may be required for a glucose meter because the AccuCheck Advantage glucose meter is presented in Procedure 19.1. The collaboration method discussed here relates specifically to this meter. The collaboration procedure is a coding procedure that is performed to ensure accurate and reliable test results. Most glucose meters require the collaboration procedure. The coding procedure must be performed each time a new container of test strips is opened. It is performed to compensate for variables that occur in the manufacturing process, which cause one batch of test strips to be a little different from another batch. The coding procedure programs the electronics of the glucose meter to match the reactivity of the container of strips that are in current use. The coding procedure for the AccuCheck Advantage is performed using a plastic code key that accompanies each container of the AccuCheck Advantage strips, figure 19.8. AccuCheck requires lot-specific collaboration, meaning that the collaboration procedure needs to be performed only once per container of test strips. This is possible because the AccuCheck glucose meter has a built-in memory system that enables it to retain a point of reference after it has been collaborated. The reference point is retained until the glucose meter is reprogrammed for a new container of test strips. The coding procedure delineated next should be followed with a new container of AccuCheck strips is opened. Ensure that the meter is turned off. Turn the meter over so the back of the meter is facing you. Remove the old code key if one is installed and discard it into a waste container. Insert a new code key by sliding it into the code key slot until it snaps into place. Turn the meter on. A 3-digit code number appears on the display screen. This number must match the code number of the vial of test strips. If it does not, repeat steps 1 through 3.
All right, very good. All right, control procedure. A control test should be run to ensure that test results are reliable and valid. and that errors that might interfere with test results are detected and eliminated. A control check is performed on an Accu-Check Advantage using commercially available glucose control solutions. 2 levels of control, high and low, figure 19.9, should be used. The control solution is effective for 3 months from the date it is opened. When the control solution is opened, the medical assistant must write down the date on the container label. The control solution can then be used for 3 months from that date, which should also be written on the container, or until the manufacturer's expiration date stamped on the container is reached, whichever comes first. The control solution is sensitive to heat, light, and moisture, and must be stored with the cap tightly closed in a cool, dry area at room temperature between 36 degrees Fahrenheit and 86 degrees Fahrenheit. A control test should be performed under the following circumstances. Go ahead and highlight 1 through 6. 1, when the meter is new. 2, daily before the meter is used for the first time. 3, when a new container of test strips is open. 4, if the cap is left off the vial of the test strips for any length of time. 5, if the meter is warped. 6, if the test result does not agree with the way the patient feels. 7, if the test has been repeated and the blood glucose result is still lower or higher than expected. If level 1 or level 2 control results are not within acceptable range, the following should be performed. Check the expiration date of the test strips and control solutions to make sure they are not outdated. Determine whether the test strips and control solutions were stored at room temperature. Make sure the container lids were tight on the test strips container and the control solution containers. Check to make sure the code on the meter matches the code on the test strip vial. Review the technique used to run the control to make sure it was followed correctly. Any errors should be corrected and the control should be run again. If the results are still not within acceptable range, the manufacturer of the glucose meter should be contacted. Care and maintenance. The glucose meter must be handled carefully. It is a delicate instrument and a severe physical jar could result in a malfunction. The glucose meter should not be placed in an area of high humidity, such as a bathroom. In addition, the meter should not be exposed to severe variations in environmental temperature, such as would occur if it were left in a closed vehicle on a hot or cold day. Proper cleaning of the glucose meter is essential for its accurate and reliable operation. On a regular basis, the exterior of the glucose meter, including the display screen, should be cleaned with a soft, clean cloth, slightly dampened with a mild cleaning agent, and it should be dried thoroughly. Acceptable cleaning agents include alcohol and mild dishwashing liquid mixed with water. Do not allow water or cleaning solution to run into the glucose meter. This could damage the internal components. Because glucose meters are battery operated, periodic replacement of the battery is required. The glucose meter alerts the user to low battery voltage by displaying a special notation on the screen. The type of battery required is specific on the operating manual along with the directions for installation. I'm sorry, y'all cannot talk today. All right. So now we are going to go to page 701. I will tell you that our glucose meter in the clinic is pretty similar to the Accu-Check. So reading that procedure would be very beneficial. All right, any questions? Okay. Anna, can you please read cholesterol?
Yes, let me get it. Cholesterol is a white fat-like substance. Normal functioning of the body, it is an important component computant of all cell membranes in the body and is used in the procedure of essential hormones and bile. Most of the cholesterol circulation is in the blood manufactured by the liver. However, a small portion of it comes from an individual diet. It is known as a dietary cholesterol. Dietary cholesterol is found only in the animal products such as organ meat, egg yolks, and dairy products. High blood cholesterol means an excessive amount of cholesterol is present in the blood. An individual cholesterol level is determined by his or her genetic makeup and by the amount of saturated fats, trans fats, and dietary cholesterol consumed. High blood cholesterol may cause fatty deposits or plaque to build up on the walls of the arteries, a condition known as arteriosclerosis.
Very good.
As the arteriosclerosis progresses, the arteries become more occluded, which eventually could lead to a heart attack or stroke. Because of this, high blood cholesterol is considered a high risk for coronary artery disease. And see the highlighted on heart disease with a focus on coronary artery disease. And efforts should be made to reduce the cholesterol levels and see the highlight on lowering cholesterol.
Very good. Thank you. Okay, so you are going to highlight the first, well, go ahead and highlight all of the first paragraph. And on the second paragraph, I want you to highlight high blood cholesterol may cause fatty deposits or plaque to build up on the walls of the arteries, a condition known as arteriosclerosis. And highlight because of this, high blood cholesterol is considered a risk factor for coronary artery disease. Okay, so ladies, let me ask this. Can a patient have high cholesterol levels and have a perfect diet and exercise daily?
Yes.
Okay, tell me why.
Sometimes be genetic or genetic.
That's right. That's right. So just like diabetes can be it can be a family inherited kind of disease, right? Like they're going to be more susceptible to develop it. Same thing for cholesterol. So just because a patient has high levels or even low levels of something does not mean that they're doing anything wrong. So as a medical assistant, you may have to emphasize this for the patient, right? If they're like, well, I watch what I eat, I exercise, I relieve stress from my life. You can do all of that and still develop certain conditions, right? Because it's not about what we're doing, it's more about how our genetic is made up. Okay, does that make sense to everyone? Any questions on that? Okay. HDL and LDL cholesterol. Jasmine, can you please read HDL and LDL?
Cholesterol is transported in the blood as a complex molecule known as lipoprotein. Two types of lipoprotein contain cholesterol: low density lipoprotein LDL and high density lipoprotein HDL. LDL picks up cholesterol from ingested fats and delivers it to blood vessels and muscles where it is deposited in the cells. LDL cholesterol is often referred to as bad cholesterol because an excess amount of it in the blood can cause plaque to build up on the arterial walls, resulting in atherosclerosis. See Table 19.1 presented earlier for an interpretation of LDL cholesterol value. HDL removes excess cholesterol from the cells and carries it to the liver to be excreted. Because HDL removes excess cholesterol from the walls of the blood vessels, it is protective and beneficial to the body and is often called good cholesterol. A high HDL cholesterol level has been shown to reduce the risk of coronary artery disease whereas a low level of HDL cholesterol, less than 40 milligrams per deciliter, is a risk factor for coronary artery disease.
All right, very good. So you're going to highlight the first sentence in the first paragraph. And then the second paragraph, I want you to highlight that LDL picks up cholesterol from ingested fats in the liver and delivers it to the blood vessels and muscle, where it's deposited in the cells. LDL cholesterol is often referred to as bad cholesterol. So remember that, LDL, bad. In the next paragraph, highlight HDL removes excess cholesterol from the cells and carries it to the liver to be excreted. And highlight where it says beneficial to the body and is often called good cholesterol. So LDL is bad, HDL is good. Highlight that a low level of HDL cholesterol is a risk factor for coronary artery disease. All right, cholesterol testing. All adults older than 20 years of age should have a cholesterol test at least once every 5 years. Highlight that sentence. Initial testing includes a total cholesterol determination, which is a combined measurement of LDL cholesterol and HDL cholesterol in the blood. To obtain a fuller picture of a patient's cholesterol status, providers typically order an HDL cholesterol determination, which means only the HDL cholesterol in the blood. Cholesterol tests are considered screening tests, and elevated results usually require confirmation through repeat testing before a diagnosis of high cholesterol is made. Interpretation of results. Cholesterol test results are interpreted as follows. Total cholesterol levels less than 200 are desirable. Levels between 200 and 239 are borderline high, and levels of 240 or higher and greater are high. Based on confirmed testing, individuals in the high category are clearly at increased risk for coronary artery disease, and individuals in the borderline high category are at increased risk if they have other risk factors, such as weight and smoking. According to the American Heart Association, an HDL cholesterol level less than 40 for men and less than 50 for women are considered a risk factor for coronary artery disease. I like that sentence. An HDL cholesterol level between 40 and 50 for men and between 50 and 60 for women are desirable, whereas an HDL cholesterol level greater than 60 is considered optimal and provides some protection against heart disease. I like that sentence. Although the primary use of cholesterol testing is to screen for the presence of high blood cholesterol related to coronary artery disease, this test is also used as a secondary aid in the study of thyroid and liver function. See Table 19.1 presented earlier for a list of specific conditions that cause abnormal cholesterol test results. Patient preparation. Because total cholesterol and HDL cholesterol determinations are not affected significantly by food consumption, the patient is usually not required to fast before collection of the blood specimen. Highlight that sentence. Some providers prefer the patient to be in a fasting state, however. If the total cholesterol level is 200 or greater, the provider usually orders a lipid profile, which includes total cholesterol, HDL cholesterol, LDL cholesterol, and triglycerides. The LDL cholesterol level is usually determined as a calculation from the triglycerides and HDL cholesterol levels. Because triglyceride levels are affected by the consumption of food, the patient must be instructed to fast for at least 12 hours before the blood specimen is collected. Highlight that sentence. An elevated triglyceride level, 150 or higher, is considered a risk factor for coronary artery disease, particularly when the LDL cholesterol is high and the HDL cholesterol is low. All right, what is LDL cholesterol? Tina, can you hear me now?
It's bad.
Okay, and what is HDL?
Good.
Okay. should you draw a blood test on a patient who has not fasted for cholesterol?
You can.
You can.
For
What do you
for
need
which
to do,
one?
though? Just in general. So if
Yeah,
a
you
patient
can.
is, one more time,
You can.
you can. That's right. But what do you need to do?
What do you mean?
Well, if the patient's not fasting and we're still going to draw the patient's blood work, what do we need to do? There's something that we need to make sure that we do.
You need to test the total cholesterol level.
No,
I don't really understand what you're saying.
so if the patient was advised to fast and they didn't, and depending on the provider, if they say yes, it's okay to go ahead and draw their blood, we need to document that they are not fasting. You need to document it on the patient's medical chart and on the lab requisition. So if your patient was advised to come in for fasting lab work and they are not fasting, before you draw the patient's blood, always make sure that you confirm with the provider that ordered the test if it is okay to still proceed. In some cases, it will be. We just need to document. In some cases, the patient will have to come back. So it's really important that we use our laboratory directory, our laboratory website, and our resources at our office to determine what preparation the patient needs to take. Okay? Any questions on that? Okay. CLIA weighed cholesterol analyzers. Lily, can you go ahead and please read that?
CLIA weighed analyzers are available for performing cholesterol testing in the medical office. An example is the Cholestech LDX cholesterol system. The manufacturer of each cholesterol analyzer provides an operating manual and sometimes an instructional video with the instrument that includes information to collect and handle the specimen, perform quality control procedures, and test the specimen. The manufacturer may also have personnel available for on-site training. It is important that the medical assistant become completely familiar with all aspects of the CLIA weighed analyzer used to perform cholesterol training in his or her medical office. Medical offices running CLIA weighed tests are required to follow the manufacturer's instructions exactly for each testing procedure. These instructions include the quality control procedures that must be performed when the test is run. Quality control procedures are of particular importance to ensure that the analyzer is functioning properly and that the test results are reliable and accurate.
All right, very good. So remember, guys, not all offices are going to have the analyzers. Some are. So just make sure you become familiar with what your office has, and make sure that you read the procedural manuals and things on the machines. All right, case study number 3. Sabrina, go ahead and read case study number 3 for me.
Karen Scrimshaw is at the office. She is 20 years old and is mildly obese. Karen had her cholesterol tested at the health fair and it was 325. The physician orders a CBC lipid profile and thyroid profile on Karen and instructs her to return in 1 week for a follow-up visit to discuss her test results. Karen is very concerned about her cholesterol. She says that she had a candy bar and some potato chips before going to the health fair and wants to know whether that she could have caused her cholesterol to be so high. She also wants to know the accuracy of machines that are used at health fairs. Karen says that if she has to go on cholesterol medication, it would be hard to decide between Lipitor or Zocor. She says she has seen them advertised on television and that they both seem pretty good to her.
Okay. All right, ladies.
So I think that we could explain to her that eating a candy bar and some potato chips it's not going to change your test results that high, right? Because it like builds up over time. So it's not like it's just, oh, you ate a candy bar and chips and now you have high cholesterol. Like,
right, it's not going to be based on the food consumption, so that should have had no effects on the blood levels.
okay.
Yeah.
So I guess explain that to her.
Okay, very good. What else? Anything else?
I guess maybe explain to her that once they get all the test results back, that the provider will be in contact with her to explain to her everything, and that he or she will be the one to prescribe her with the medication, not necessarily from a TV commercial, just off of like them as a person.
That's right. Yeah, and you guys will actually get that a lot. They're like, oh, well, I read about this one. Can we be put on this one? Well, maybe, right? But the doctor is going to ultimately decide on what medication is best. And plus, the upside to working with an electronic medical record is we can see what medications the patient's insurance is going to cover. So her insurance may not even approve Lipitor or Zocor. So yeah, I mean that'll be a doctor's decision. Very good. All right. Anything else? All right. What do we not want to do?
We could also explain to her that the machines at the health fairs are, quality machines.
That's right. Very good. So that's right. We're going to, let her know that, the machines that they use, we have to do quality controls on them. So more than likely the machines were working properly. Very good. Very good point. All right. Anything else? All right. What do we not want to do?
Make her feel weird or like dumb for asking if her food is the reason for it.
That's right. Yep, that's right. And we don't want to be rude. We don't want to make her feel bad for not knowing. That's right. All right, very good. Any questions? Okay, let's go on over to page 704. Triglycerides. Triglycerides are the chemical form in which most fat exists in food as well as in the body. I like that sentence. Triglycerides are derived from two sources. The first is synthesis by the body. Ingested glucose that is not needed for energy can be stored in the form of a glycogen in the muscle and liver tissue for later use. When no more tissue storage is possible, most of the excess glycogen is synthesized by the body into triglycerides, a form of fat, and stored as adipose tissue. Excessive protein not needed by the body is also converted to triglycerides and stored as adipose tissue. The second source of triglycerides is food. Excessive triglycerides consumed by eating foods containing fat are also stored as adipose tissue. Some of the triglycerides in the body are not stored as fat but remain in the bloodstream, specifically in the plasma. Most triglycerides in the bloodstream are carried by lipoprotein known as very low density protein, VLDL. In normal amounts, triglycerides are essential to good health. Triglycerides carried by the blood serve as a major source of energy for the body. An excess of blood triglycerides, however, places an individual at increased risk for coronary artery disease, particularly when the LDL cholesterol is high and the HDL cholesterol is low. Triglyceride levels in blood are usually measured as part of a lipid profile and are interpreted as follows. All right, what is LDL cholesterol?
Bad.
What is HDL?
Good.
Very good. All right, so normal is less than 150, borderline high, 150 to 199, high, 200 to 499, very high, 500 and over, which is seen quite a bit. All right, conditions that result in elevated blood triglyceride levels include obesity, type 2 diabetes, being physically inactive, excessive alcohol consumption, smoking, hypothyroidism, kidney disease, and liver disease. I like that sentence. Blood urea nitrogen. The blood urea nitrogen, BUN, is a kidney function test. Highlight that sentence. Urea is the end product of protein metabolism and is normally present in the blood. Certain kidney diseases may interfere with the ability of the body to excrete the urea properly, causing an increased level of urea in the blood. See Table 19.1 presented earlier for a list of specific conditions that cause abnormal BUN test results. All right, immunology. Natalie, please read immunology.
Immunology is the scientific study of antigen and antibody reactions. An antigen is a substance that is capable of stimulating the formation of antibodies in an individual. Antigens may consist of protein, glycoprotein, complex polysaccharides, or nucleic acid. Specific examples of antigens include bacteria and viruses, bacterial toxins, allergens, and blood antigens. An antibody is a substance that is capable of combining with an antigen, resulting in an antigen-antibody reaction. Laboratory testing in immunology deals with studying antigen-antibody reactions to assess the presence of a substance, for example, ABO blood typing, or to assist in the diagnosis of disease, for example, mononucleosis testing. Immunologic tests are often used for the early diagnosis of disease and are used to follow the course of the disease.
Very good. All right, so in the first paragraph, you're going to highlight starting this at the second sentence. all the way to the very end of the first paragraph. All right, Sabrina, go ahead and read hepatitis test.
Hepatitis testing is performed to detect the viral hepatitis. There are five types of viral hepatitis: A, B, C, D, and E, which are described in detail in Chapter 2. Hepatitis testing is not only detects the presence of viral hepatitis, it also determines the type of hepatitis present.
Very good. All right, so I just want you to highlight the words hepatitis testing. Talia, can you please read HIV test?
The immune assay (EIA) test and the enzyme-linked immunosorbent assay (ELISA) test are used to screen test for the presence of HIV. Real rapid screening HIV test kits are also commercially available. Brand names include UNI Gold, Republian, HIV, Trinity Brochit, PLC Gray County, Whitlock, Ireland, Clearview HIV, and the Oral Quickly Rapid Test HIV test. Because of the possibility of false positive results, a second screen test is always performed if a blood specimen tests positive. If the second test is also positive, a more specific test, such as the Western blot test, is performed to confirm the test results. An individual who tests positive for HIV is seropositive. A negative HIV test is not conclusive for the absence of HIV infection. If any individual has recently been infected with HIV, the antibodies may not have time to develop. It generally takes 2 to 12 weeks, but possibly as long as 6 months, for the HIV antibodies to appear in the blood.
Very good. So because of this is why when someone comes in to do the HIV testing, it's kind of like the hepatitis B vaccine. Like you get one today, you'll come back in a certain amount of time to get the next one, and then repeat at another date. It's because sometimes the antibodies have not had time to build up, to form in the blood test. So that's why we repeat it. All right, syphilis test. Tina, can you please read syphilis test?
Syphilis is a sexually transmitted disease caused by the microorganism Treponema pallidum. The most common tests used to detect the presence of syphilis are the Venereal Disease Research Laboratories test and the Rapid Plasma Rain test. Test results are reported as non-reactive, weakly reactive, or reactive. Weakly reactive and reactive test results are considered positive for the presence of syphilis antibodies. These tests are screening tests, and a positive result warrants more specific testing to arrive at a diagnosis of syphilis.
Very good, thank you. Okay, so you're going to highlight that syphilis is a sexually transmitted disease, STD. Highlight the most common test used to detect the presence of syphilis is the Venereal Disease Research Laboratories, VDRL, and the test and the Rapid Plasma Rain test, or RPR. Mononucleosis. Alexis, can you read mononucleosis test? All right, Alicia, can you please read mononucleosis test?
The mononucleosis test, monotest, is used to detect the presence of infectious mononucleosis. The theory and procedure for this test are discussed in detail in this chapter.
Very good. Just highlight the words where it says monotest. Rheumatoid factor. Rheumatoid arthritis is a chronic inflammatory disease that affects the joints of the body. The blood of patients with rheumatoid arthritis contains a type of antibody called rheumatoid factor, RF. This test detects the presence of rheumatoid factor antibodies and assists in the diagnosis of rheumatoid arthritis. Highlight the words rheumatoid arthritis. Anti-streptococcus O test. The anti-streptococcus ASO test, highlight the words OASO, is used to detect ASO antibodies in the serum. It is the most widely used immunologic test for detection of conditions resulting from streptococcal infection and diseases that occur secondary to streptococcal infection. This test is useful in assisting in the diagnosis of rheumatic fever, glomerulonephritis, bacterial endocarditis, and scarlet fever. C-reactive protein. During inflammation and tissue destruction, an abnormal protein called C-reactive protein, CRP, appears in the blood. Patients with inflammatory conditions or disorders accompanied by tissue destruction have positive results to this test. Because of this, the CRP test is used to assist in diagnosing and documenting the progress of rheumatoid arthritis, acute rheumatic fever, widespread malignancy, and bacterial infections. Cold agglutinins. The cold agglutinins test is used to detect the presence of antibodies called cold agglutinins. This test is performed by incubating the patient's serum with erythrocytes at cold temperatures. If cold agglutinins are present, this causes agglutination of the erythrocytes. Cold agglutinins are found in the patients with infectious mononucleosis, mycoplasmal pneumonia, chronic parasitic infections, and lymphoma. ABO and Rh blood typing. Blood typing is performed to determine an individual's ABO and Rh blood type. Knowledge of the blood type helps to prevent transfusion and transplant reactions and to identify problems such as hemolytic disease of the newborn. The theory and procedure for ABO and Rh blood typing are presented later in this chapter. Rh antibody titer. Rh antibody titer test detects the amount of circulating Rh antibodies in the blood. These antibodies can occur in a pregnant woman who is Rh negative and is carrying an Rh positive fetus. This test is most frequently used to detect the presence of an Rh incompatibility problem with a mother and her unborn child. Highlight that last sentence. Rapid mononucleosis testing. Infectious mononucleosis is an acute infectious disease caused by the Epstein-Barr virus. Highlight that sentence. Infectious mononucleosis most frequently affects children and young adults. It is transmitted through saliva by direct oral contact, and because of this is often called the kissing disease. Symptoms of infectious mononucleosis include mental and physical fatigue, fever, sore throat, severe weakness, headache, and swollen lymph nodes. Highlight those last two sentences.
I had that for like a month.
Uh-huh.
Yeah, and like when I was in college, it was going around. No, when I was in college, it was like going around on the track team, and like no one knew, and I had it for a whole month. Like I went to the clinic and everything, and they couldn't detect it. But when I came home and went to the doctor, they was like, "You have mono," and I was like, "Huh?"
Yeah, I'm gonna tell you, it sucks to have it. Like some of the symptoms are pretty rough.
Yeah.
But it's common, especially in the kids. The CLIA-waived rapid mono test is often performed in the medical office and is used to assist in the diagnosis of infectious mononucleosis. Rapid mono tests are easy to perform and provide reliable results in a short time. Patients with infectious mononucleosis produce an antibody called heterophil antibody, usually by 6 to 10 days into the illness. Rapid mono tests detect this antibody. The presence of the heterophil antibody, along with the patient's symptoms, can provide the basis for the diagnosis of infectious mononucleosis. Figure 19.11 illustrates the Quick View mononucleosis test setup, Quidel Corporation, San Diego, California, and Figure 19.12 outlines the procedure for performing a rapid test using the Quick View mononucleosis test. Figure 19.13 illustrates positive and negative test results for the Quick View mononucleosis test. All right, blood typing, blood antigens. Let's see here. Talia, can you please read blood antigens?
Each individual has a blood type. Blood types depends on the presence of a certain factor of antigens of the surface of the red blood cells. Blood antigens consist of proteins inherited through genes, which programs the bodies to produce a particular antigen. If a blood antigen is present, it appears on the surface of all the red blood cells in the body. Many types of antigens can appear in the blood. These antigens can be grouped into categories known as blood group systems. The blood group systems that are mostly likely to cause problems in blood transfusion and in Rh diseases of the newborn are the ABO and the Rh blood group systems. These are blood group systems most commonly tested for in medical laboratory. Within the ABO blood group systems are four main bloods, AB, and O. Blood type depends on which antigens are present at the surface of the red blood cells. If the A antigen is present, the blood type is A. If the B antigen is present, the blood type is B. If A and B antigens are present, the blood type is AB. If neither the A nor the B antigen is present, the blood type is O. Figure 19.14 illustrates this principle.
All right, very good. All right, so you're going to highlight the second sentence and highlight the last sentence on the first paragraph and highlight each bullet point. Do you ladies know what blood type you are?
Yes.
Yes.
Yeah. What blood type are you?
O. I think I'm O
A.
positive.
A, O, yeah. What was yours, Anna?
I think it's O positive or O negative.
Negative. Yeah, I think I'm AB positive.
Which one is really where?
I think it's O. That's rare, or it used to be. All right, blood antibodies. Tina, can you go ahead and read blood antibodies?
Antibodies are proteins that are naturally present in the plasma of the blood. An antibody is a substance that is capable of combining with an antigen. The body never produces an antibody to combine with its own blood antigen. If the blood type is A, the plasma does not contain antigen. If the blood type does not contain the A antibody, the B antibody naturally occurs in the plasma, however. The B antibody cannot combine with the A antigen. If a blood antigen and its corresponding antibody combine, in this case, the A antigen combining with the A antibody, a serious antigen-antibody reaction occurs that could be life-threatening. If the blood type is A, the plasma contains the B antibody. If the blood type is B, the plasma contains the A antibody. If the blood type is AB, neither the A nor the B antibody appears in the plasma. If the blood type is O, A and B antibodies appear in the plasma. The type O blood has either the A nor the B antigen on the surface of red blood cells. The A and the B antibodies in the plasma would not have an A or B antigen to combine with them.
Very good. That's a mouthful, right? That's a lot.
Yeah.
Okay. All right, so you're going to highlight the first sentence and then highlight each bullet point. All right, Alicia, go ahead and read RH blood group system.
In 1940, hold on, I'm trying to finish highlighting. Okay. In 1940, Landsteiner and I can say that.
You okay over there?
Okay. Describes the RH blood group system while working with rhesus monkeys. Most people in the United States have the RH antigen present on the red blood cells and have type Rh positive blood. The remaining 15% of the Caucasian population and 7% of the African American population do not have the Rh antigen present on the red blood cells and have type Rh negative blood. In contrast to A and B antibodies, the Rh antibodies do not normally occur in the plasma.
Very good. Okay, so you're going to highlight the Rh antigen present and Rh positive blood, and then highlight where it says do not have the Rh antigen present on the red blood cells and have type Rh negative. All right. Anna, can you go ahead and read blood antigen and antibody reaction?
When a blood antigen is corresponding, antibodies acute. The result is the clumping and elongation of red blood cells. Elongation of red blood cells can be serious and fatal if occurs in vivo,
In vivo.
in vivo, in the living body. The clumped red blood cells cannot pass through the small tubulins of the kidneys, and this may lead to kidney failure. Also, the clumping of the red blood cells eventually lead to hemolysis or breakdown of the red blood cells. Antigen antibody reaction can occur if the wrong blood type is administered to a patient during a blood transfusion. If an individual with type A blood is giving a transfusion of type B blood, the B antibody of the recipient, the person receiving the blood, would combine with the B antigen of the donor, and an antigen antibody reaction would occur, resulting in coagulation of red blood cells. We say that type A blood is incompatible with type B blood.
Very good. Okay, so in the first paragraph, I want you to highlight the second sentence and the last sentence. Alicia, it's okay. I know you're not. I think some things are just, it's just funny, right? I just can't help it. All right. Let's see here. Jasmine, go ahead and finish us up with agglutination and blood typing.
Agglutination of red blood cells is the basis for the ABO and Rh blood typing procedure. The antigen-antibody reaction occurs in vitro or in glass in the laboratory, so there is no threat to life. The test for the ABO blood group system, a commercially prepared anti-serum, is used. An anti-serum is a serum that contains antibodies, and an anti-serum containing the A antibody is added to an unknown blood specimen. If the A antigen is present, it combines with the A antibody, resulting in agglutination. An anti-serum containing the B antibody is added to another sample of the unknown blood. If the B antigen is present, it combines with the B antibody, resulting in agglutination. If agglutination occurs in both instances, the sample is type AB. If no agglutination occurs, this indicates the absence of blood antigens.
You're okay. I know, it's okay. Go ahead and finish this up.
This indicates the absence of blood antigens or type O blood. Agglutination that occurs in vitro is visible to the naked eye. The antigen-antibody reaction that occurs with the unknown blood sample is type A, is diagrammed in figure 19.15.
All right, very good. All right. Any question, ladies? Okay, then we are done for the morning lecture. You ladies need to make sure you send me your results from the Chapter 18 study guide. Make sure you do your Chapter 8 test in Evolve and the Chapter 19 assignments in Evolve. And then at 1 o'clock, again, we're going to have an open discussion floor for anybody that wants to hop on and go over anything. And then remember, I'll send out a reminder, but because tomorrow's Friday, this will be the last time I open any assignments up in Evolve. And as well as if there are any missing assignments, if I do not receive missing assignments by Sunday night at midnight, they will be zeros. So please make sure that you you get your stuff turned in. And then because tomorrow's Friday, oh, again, I don't even know if I finished saying what I was going to say. It's your responsibility to let me know first thing in the morning what you need opened up, and I will open those up for you. Any questions? Whoop, whoop. All right, you ladies are set to go. Y'all have a good day. I will talk to y'all later.